It's the perfect time of year to hit the trails for a nice long jog. However, some running enthusiasts may find their workout plans sidelined by an injury. Joining us today is physical therapist Bill Nicholson with some steps you can take to limit your risks of getting hurt and also what to do if you already have an injury. Welcome to the program,
Thank you.
Bill. So, there are a lot of 5Ks right now, a lot of marathons in the summer. Do you see more injuries this time of year?
We see injuries throughout the year. As a running injury, that can be overuse. So at the very beginning of the year, they get excited about running, they go out and then they try to do too much too soon. During the summertime, after training has started, then we see these injuries kind of manifest themselves as an overuse injury.
So it takes a little bit of time to show up sometimes?
Sometimes it does, that's correct.
What is the most important thing a first-time runner should do? I hear a lot about people, I'm going to go out and run a half marathon, no training whatsoever. Can you give them some advice?
Yeah, one of the first and easiest things you can do is stretch. You can contact a physical therapist, you can Google things, but stretching is one of the most basic things you can do before, and I prefer after as well. Beyond that, you can get your gait, the way you run, analyzed. You can get proper shoes. So there's a whole spectrum of things you should do, but the first and foremost easiest thing is just to stretch.
Should you warm up before stretching, and what would a warm-up consist of?
Warm-up could be a gentle jog before you go for your normal pace. It could be a bicycle, it could be stretching. They even have these things called foam rollers that I personally like. It helps us stretch out even more, but just something to get the blood flowing would be a good thing to do.
Now, what are some common complaints you hear from people with running? What's the most common?
One of the most common would be the IT band syndrome, which would be a pain on the outside of the knee, possibly in the hip. Another thing we see are shin splints, and if they're not treated right, could turn into stress fractures. And one more thing would be just your generalized aches and pains of running. People that are overzealous, they get out there and try and do things too soon, and their knees just hurt.
Now, you mentioned shin splints and stress fractures. Is there a difference between the two? If so, what is the difference?
Yeah, shin splints are the result of over-injury or overuse that can cause an injury. If a shin splint is not properly treated in time, it can progress into a stress fracture, and in that case, the runner, will be sidelined for an extended amount of time.
Now, a stress fracture, is that an actual breaking of the bone?
Technically, no. It's when the muscle starts to pull away from the bone. Basically, your muscles are doing more work than your bone can handle, and your bone just gets weak. And don't think of it like a snap. Just think of it as a stress of the muscle that's kind of pulling away from the bone.
Are there any dietary changes? Could someone drink more milk or take calcium supplements? Would
Yeah,
that help at all?
we hear that a lot, actually. For somebody who's running, protein is very good. I would do a high diet of protein. Calcium in order to keep your bones stronger in preparation for running. If you have questions as far as that goes in more depth, I would talk to a dietitian or a nutritionist. They have all the answers for you and can recommend something for you specifically for your needs.
Now, when we were talking about the shin splints, that's the pain on the front of the leg. Are there exercises someone could do to improve that, or do you just have to stay off of it for a while?
Initially, it's just rest and ice, but in order to get back into the activity and to prevent hurting yourself again, yes, there are some exercises and stretches and strengthening things you can do to make yourself a little more okay with that running activity once you return to it.
Now, you mentioned earlier the IT band injury, and we hear that a lot. I've been in a few races myself, and I'm always hearing that's kind of a common complaint. Mm-hmm. Does that have to do with some sort of structural defect, or is there anything you can do to avoid that?
There are a lot of things you can do to avoid that. People stretch their front part, their quads, and their hamstrings in the back, and they forget about the muscle on the side a lot. So one of the first things you can do is to find an IT band stretch that works for you. There are plenty of them out there. Start with the stretches. Beyond that, you can have a physical therapist take a look at you, work on some soft tissue mobility things that can help also loosen up that. But it isn't a structural thing. It's a thick fibrous band on the side of your leg that runs from your hip down to your knee. And that muscle gets tight, just like any other muscle. So when it gets tight, people have a sharp, stabbing kind of pain in the side of their knee a lot of times. That can prevent them from running at all.
If you experience that during a race, should you stop and walk, or should you, will it hurt you to keep going to try to get a good time?
It will hurt you because it's going to hurt. Will it cause any structural damage? It depends how much more you have to go, I guess. If you're a mile from the end, I understand. You probably want to push it. But In general, yeah, it's best to stop, especially if you're just training. It's best to stop and rest it and have somebody take a look at it.
Now, you also mentioned earlier the runner's knee. What is that, number one, and is there anything we can do to prevent that?
Runner's knee is technically the IT band syndrome, is what we call it. It's a generalized term for the public. However, a lot of people that begin running, they have pain in their knee simply because they're doing something that's brand new, or they've increased from 1 mile to 3 miles, and they get that soreness in their knee. Soreness in your knee is okay. It's normal as long as it's mild, and it can resolve after a couple of days. Especially normal if it happens after you increase your mileage. What isn't normal is that sharp, stabbing kind of pain on the inside part of the knee. That could be something a little more serious, and that's something that you want to have somebody take a look at. But if it's just the aches and the pains that go along with activity, it's okay.
That might go away with time.
It might go away with time and getting used to the activity itself.
And if it doesn't, give you a call.
Exactly.
And speaking of that, how can our viewers reach you if they have any more questions?
Well, my email is probably the best way. It's william.nicholson@PhysioCorp, that's PhysioCorp.com.
Wonderful. Thank you for being with us.
Thank you for having me.
We'll be right back with more Mind, Body, and Spirit.